Hello and welcome to Mwalimu Kipepeo, a podcast that seeks to impart knowledge to all our listeners. My name is Jasmine Omboi and I am glad that you have joined us today as we talk about the effects of COVID-19 on mental health. I hope you'll all learn something new as we continue to grapple with this global pandemic. So, is it business as usual? Let's find out from a frontline worker. My guest today is a frontline worker, a doctor who has been working in the CBD, smack in the middle, even during the height of the pandemic. I met him through my younger brother, who is also a frontline worker in the coast. The two met as Kenyan medical students in China. Dr. Hilary Tarus reached out to me because he felt that this was an important topic of discussion on this platform, and I thought it was a brilliant idea. So here we are. Hi, Daktari. Please introduce yourself to our listeners and let us know what you enjoy doing most when you're not saving the world.
Hi guys. My name is Dr. Hilary Tarus. I am a medical doctor, a general practitioner to be exact. I trained at Southern Medical University in Guangzhou, China, and at present I work for Karen Hospital. I love traveling. I love music. I love the outdoors, going to new places, meeting new people, trying out new things. And I also believe in personal improvement, becoming the best version of yourself. And also thank you very much for giving me this opportunity, for inviting me onto your platform. So let's get this.
Okay, so thank you, Daktari, for that great introduction of yourself, the things that I didn't know about you that I've known today. Well, let's get straight into it. So tell us, how has COVID-19 affected mental health, either directly or indirectly?
So how has COVID-19 pandemic affected mental health, directly or indirectly? One, isolation and social distancing. Although it's an important tool in slowing down the spread of COVID-19, and we should try our best to adhere to the protocols presented by the Ministry of Health. Isolation or detachment from other people can lead to depression, can lead to anxiety, or at least worsen the symptoms of depression and anxiety and other mood and personality disorders. By nature, human beings are social creatures. We are wired to want human interaction to some degree. And when we're detached by that from human interaction, it is very normal that our mental health starts to take a toll for the worse. Another way which COVID-19 has indirectly affected mental health is it has caused an economic crisis. And once you have an economic crisis, you have people being in the darkest places, being in feeling very hopeless about the future, which can increase the rates of suicide. It can also lead to alcohol and substance abuse. It was even reported by NACADA sometime last year that during the lockdown period, the online sales of liquor was very high. And even in the medical profession, a lot of we've noticed a lot of people who are recovering addicts relapsed a lot between the year of 2020 and 2021.
What are your health recommendations in regards to whatever is happening right now?
My recommendations to make things better is it's important to first of all educate yourself on the signs and symptoms to look out for. Feelings of depression and anxiety, aggressive behavior, a passive attitude, poor sleep quality, cognitive decline, an altered memory, poor self-care. You need to first of all educate yourself on the signs that you should look out for, and then the things that you can do is, on a personal level, even before you seek professional help, which you should, is to maintain regular routines, create a schedule for learning, activities, relaxation, and fun. Also find hobbies or activities you enjoy. Take time to learn a new skill. Talk to trusted people about your concerns, about your feelings. You can call, you can text, you can video chat if you cannot meet up with a person face to face. Limit exposure to news coverage, including social medias. You should only get your information about the pandemic from a trusted source, or any other, future pandemics, God forbid. Also focus on eating healthy, well-balanced meals, regular exercise, sleep, and also avoid taking alcohol or any mood-altering drugs. And also be your brother's keeper. You need to check on each other.
Dr. Ruth, please tell us some of the challenges that the frontline workers have experienced throughout this pandemic, and even now, as we are still grappling with whatever is happening. It's not yet gone. People think it's gone, but it's not yet gone. So what are some of the issues that frontline workers have gone through?
What are some of the challenges faced by frontline workers? Lack of personal protective equipment. Most of them had to work without the proper gear, the proper clothing, the proper attire that was put up, that was recommended by the WHO. We had them getting infected, some of them. We also lost some of very brave men and women in the front lines. Another problem which was faced by them was low social acceptance, especially in the initial stages of the pandemic. There was a stigma around. They faced stigma from the society, from their friends, to some extent or to some degree, because they were viewed as probably contaminated. This was during the time when people did not really truly fully understand how you can contract COVID-19. Another problem was mental health problems in general. Remember, at the end of the day, your doctor is also a human being and is also bound to the same, to get the same emotions as any other human being. Also, there was lack of incentives by the government in general. We had a lot of people working for long hours without pay. Another problem which they faced was lack of coordination and direction from the WHO and the Ministry of Health. There was a lot of breakdown of information. Do this, do that. A lot of things were not clear. There was also high workload in general. A lot of people had to clock in a lot of hours, and work a lot. The patient to doctor ratio in Kenya, in other words, the doctor to patient ratio in Kenya is 1 to 16,000. So you can imagine the amount of traffic that a doctor will have to take care of, in the event of a pandemic when everyone is sick.
Okay, I think some of our listeners would like to maybe see you, come and find out more information about whatever we've discussed today, or even for your services. So where can they find you for further information in case someone needs to get to know you more or get to receive your services?
You can find me Cardinal Lutunga Plaza on the first floor, the Karen Hospital Town Clinic. It's on Cardinal Lutunga Street, just behind GPO. You can also reach me on my Instagram, Dr. Tarus, DRTARUS. I'm pretty sure, hopefully, the link will be in the description of this podcast. Wamboi, I'm talking to you, yeah?
Of course, I'll do that. I will share your details on our Facebook page. So please follow the Facebook page, Mwalimu Kipepeo, and you'll get all those details there of how you can get in touch with Dr. Hilary Tarus. So as we conclude, Dr. Ari, please give us your parting shot.
So my parting shot is this. Unfortunately, we live in a continent where mental health is not taken with the same seriousness or urgency that it deserves. And it is up to us to educate ourselves and to educate the future generations so that we can steer this ship in the right direction. I'm not aware of the demographic of this podcast, of your listeners, but I'm speaking to all the men out there who are listening to this. Or, if you have a brother, you're a female, you have a brother, you have a husband, a nephew, whatever case it may be, men are 3 to 5 times more likely to commit suicide successfully than women. And my message to them is, do not seek permanent solutions to temporary problems. Okay, let me rewind that. Do not seek permanent solutions to temporary problems. I do understand that life is tough, it is difficult, especially when a lot is expected from you, and also seeing what has happened in the previous years. Unfortunately, life does not get easy. People get stronger. So thank you for inviting me to this to your podcast. I do really appreciate this. Thank you so much, Wamboy. Shout out to you.
In November 12, 2012, armed cattle raiders killed at least 32 Kenyan police officers in a military-style ambush in Samburu. This was said to be the worst attack on police in Kenya's history. The police were pursuing raiders from the ethnic Turkana community who had stolen cattle from the Samburu people. The two groups frequently raid cattle from each other and fight over grazing land and watering points. Sadly, just 8 days ago, fighting broke out again after gunmen raided villages and stole about 1,000 animals in Samburu North, killing 14 people and injuring 5 others. Well, now you know. I'm Jasmine Wamburi, and you've been listening to Mwalimu Kipepeo, the podcast. You can follow Mwalimu Kipepeo on Facebook. If you haven't yet, please rate and review this podcast. Join me next week for another episode of Mwalimu Kipepeo. Thank you for listening.